the doctor committed suicide, but she left a note and she clearly stated that it was after a 36 hours call straight. She was on call 36 hours. So when she came back home, she left a note that she was depressed, she's tired, stressed, and all of that, and she just can't take it anymore, and she took her life. You are working now for 24 hours because you are on call. You continue to work for the next day for another 8 hours, making it 36 hours. And then you're on call again the next day. You continue 48 hours, 72 hours. In extreme cases, 1 week, you have doctors on call.
Good evening, folks. You're welcome to another edition of the Happy Benyola podcast. I hope you're all in good spirits tonight. Tonight, we're going to be talking about something that's very important to practically everybody on planet Earth, and that's health. And when it comes to the healthcare, it's something that everybody, has somewhere at the back of their mind. How do I keep myself in good health? But in order for you to keep yourself in good health, you need some assistance. In a lot of cases, you need assistance from doctors, medical personnel. So doctors, nurses, orthodontists, dentists, name it. I mean, there's a myriad of names and terms I can't remember off the top of my head. Now, according to Nigeria's Minister for Health, Muhammad Ali Pate, I'm not sure if I got that pronunciation right. This is Pate or Pate. 15 to 16,000. Did I get it right?
I think it should be the pronunciation for it.
Yeah, what I mean. So 15 to 16,000 doctors have departed Nigeria in the last 5 years. I mean, that's an unprecedented number. Most of them have, left probably because of that popular term, japa. Japa in Yoruba parlance, for those who don't know, basically means fleeing from something or running away. 5,000 of those doctors went to the UK alone. We're speaking to one of them right now. So that should tell you what's going on. A lot of those doctors are leaving after claims of sky-high inflation, low wages, salaries, and also an overstretched healthcare system. So today, Nigeria, Africa's most populous nation, with a population of roughly 230 million people, has only 55,000 doctors. It's shocking. It is scary. Tonight, we're going to be speaking with Dr. Alamin Usman, a medical doctor and an advocate for better welfare for Nigerian doctors, particularly on regulated working hours. Apparently, it seems that he's the only person that's actually talking about regulated working hours. And that's why he seems a perfect fit for us to have a conversation with tonight, because that issue of regulated working hours is also very key into why doctors are either jack or dying somewhere else.
However you want to mention it,
However you want
the
to
jar
mention
is
it,
still good.
So now, I don't think it make you laugh initially, but why are Nigerian doctors living in such high numbers considering the Hippocratic oath?
So before I start, thank you once again, Habib, for having me on this platform.
That's super.
You've laid a very, sound foundation of the reality of health workforce in general, not only for doctors, but the healthcare workers, the health, the manpower of, the health workers in Nigeria. And indeed, you've mentioned that it is shocking that we have only 55,000, according to the Honorable Minister of Health, Dr. Muhammad Patwi. Only 55,000 doctors left as of 2023, if I recall. When he said that. And it would excite you to know that that number, as true as it is not a true reflection of the number of practicing doctors that are presently in Nigeria. And that is even
you mean they are much lower?
Even at that.
Because when you say excite me, that will be positive or negative.
I'm telling you, with the fact that the Japa syndrome of a thing is still rolling, so you would expect that if let's say about 100 to 200 or maybe 300 or 400 or 500 up to 1,000 doctors leave every month, as some, reports have said it, then from 2023 to 2024 now, you would expect that that number have, reduced significantly. Now to your question, why is it that we have this surge in, you know, people leaving the country, doctors leaving the country? And the honest truth is, we might cut corners and say, um, it's because they just want to have a better life outside and all of that. But it all boils down to the fact that they don't have that better life back in Nigeria. You know, better working condition, better remuneration, you know, better environment to work with and work in. And that is generally, the reason why any doctor that would, um, you know, after ending up, being trained in Nigeria or abroad and came back to Nigeria to practice, decide one day with his family and everyone around him that, you know what, I'm fed up and I have to leave. It's a big, decision to make,
Yeah.
and you wouldn't expect that someone will just make it lightly. So those are the reasons
So
that we have
do they
doctors
do
in the
they
country.
actually get better working hours abroad, even though the pay is considerably higher and all that? Because I did see a BBC documentary where a Nigerian doctor, yeah, the doctor was Nigerian, and he was actually talking about him being hired by an agency. So it was the agency that was responsible for his welfare as opposed to the NHS trust he was working with. And he said he was working more or less, and I quote, slave out. So do they truly get that?
So in general, to be very honest and to be fair, for all these developed countries, the healthcare system in general everywhere has its own, problems and challenges. As every time the Honorable Minister of Health comes out, he states that no healthcare system everywhere in the world is perfect. But there is that thing that they do that make it, a bit better and, acceptable by a lot of, doctors or healthcare providers that tend to migrate to those places. The word slave that you say, it all depends on, of course, the agency that someone went through. A lot of people get jobs directly with the NHS. Some do get jobs through, they start through agencies, and unfortunately, you're tied to a contract, and you're also tied to the pieces of that contract that you signed with.
Yeah.
And for agency, all they want is to get their money. So they will always want to send you off to work for this, work for that. But no matter what agency, for example, like the United Kingdom, there is a cap on the working hours. Whether you're working for an agency, whether it's a private or a government institution, there is a cap. And unless you signed out of that, you know, 40 hours a week, unless you signed out of that, then you're still bound by, there is no employer that would make you work more than that per week. So there is that regulation. You know that if that doctor needed help, he would definitely have had the help that he needed if he had, channeled it to the right, regulatory bodies, because there are regulations in the country. And that is what we are missing back home in Nigeria. Those regulations are not in place. There's nowhere you can, it is already considered the norm for someone to work. In fact, some people pride with it. They say when you work for 1 week straight, then you are a very hardworking person and you're considered the hero of, whatever. And it's just so sad.
So why are regulated working hours not taken very seriously, considering the impact it will have on a doctor's performance? Because say, for instance, if I was talking to a truck driver, for instance, right? The truck driver probably can only drive for a certain number of hours. You have a tachometer and all of that. So the driving hours that he can are regulated. Yet I know that in Nigeria you don't have any such thing, but then nobody wants to die. So the minute you start to feel sleepy and you know you're driving an articulated vehicle, something that you're probably going to want to park somewhere and take a nap, reboot before you now get back on the road. But as of that point in time, that driver is in total control of whether he can park and take a nap, so he can do that. As opposed to a doctor who is on call, who doesn't have any control over, I'm going to go and take a nap, or I've worked the number of hours I'm going to work. Why don't they take it that seriously?
That question, Habib, has been a question that in fact, that was one of the things that pushed me to, ask, this these questions that and we're where we are right now. It's been going on for years. I mean, donkey years, even before I thought of, you know, wanting to study medicine, that the system allows it for a doctor in Nigeria to be on duty um the whole day, 24 hours, and he could take, call, which is used being in the hospital, manning the hospital as a doctor, whether alone or with your intern, you know, or with a senior. Most of the times, if there is a senior, he's not always around because seniors will always be seniors. They will be
Yeah.
away. You will only call them when you need them. A junior doctor will be in the hospital, and um, he will be on duty for 24 hours. He will go again to be on call for another, you know, 8 hours in the night till in the morning, making it almost 36 hours, and then continue the work for the next day again till the closing hours of that day before he sets for home. So in total, you're looking at 36 to almost, 40 hours stretch. Someone is on
Stretch.
duty. Stretch. Now, in very, very extreme situations, you will have someone that is on call back to back. So you are working now for 24 hours because you're on call. You continue to work for the next day for another 8 hours, making it 36 hours. And then you're on call again the next day. You continue 48 hours, 72 hours. In extreme cases, 1 week, you have doctors on call. I published a roster in my recent presentation at the, Healthcare Consults in Lagos 2024, the conference. A roster of a doctor who was on call, who was on duty the whole month, Habib,
Yeah. The whole month.
every single day, back to back. And this roster pass through, you know, the the hospital management, the consultants, the trainees, the chief regis in the hospital and all of that, the seniors, and people sign on it, agreeing that it's okay for this person to continue like that. And you would wonder, how how is it that in our right senses, in our most human form, we agree to that form of, you know, allowed stress to go on for someone like that? And the honest truth that a lot of people will tell you that this is what I've been through when it was my time before I became a consultant, and it made me who I am today. Those experiences made me who I am today. So you cannot complain about it as well. And it's just so sad that we have the same advice that we would give, patients. If someone comes to me and says, I'm driving for almost 48 hours, without sleeping, I'll be like, no, 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 please don't do that. Don't do that. And that is what is expected of me by oath to say to him. But then I am now making myself go through the same thing. Doesn't make sense, does it?
And that's one of the most dangerous things that anyone could do. So now, what's baffling me is 230 million divided by 55,000. That's an average of 42,000 people to one doctor.
What I mean?
I mean, I had to do the math, again, just to,
Yeah.
to refresh myself, because I saw a figure somewhere that said roughly about 50,000 to one doctor. Is it a case of it's actually because of the shortage of personnel? That's why doctors are giving such, crazy hours to work.
So recently, it has been tied, to the fact that it's because we have, a shortage of healthcare personnel, and that is why
Yeah.
we are having, this burden on doctors. But this burden has always been there. As I've said it, doctors, this is the normal routine for doctors. Every doctor in Nigeria has gone through this system. Whether they've had, 10 doctors at a point or just one doctor at a point, you would be on call, you continue the work the next day. So it doesn't really matter if there were 10 people in the department and all the 10 people will have to undergo that stress. What it means is that, instead of the productivity of the 10 people to be high is still the same as just one person being on call. I mean, just one person in the department because they're all going to be stressed. It's the same as just one person working in the department. Yeah, I don't understand. I don't know if you got what I mean.
So when you say
You
working in
have
a
10 people.
department, that means that you're talking of in a ward or what?
Yeah, whether, if, let's say, what, you have 10 doctors
Yeah.
in pediatric, let's say emergency, or in the pediatric department, you have 10 doctors, and you would expect that two doctors will be on call every other day. You know, if two doctors are on call every other day, that means you have like just one day in between for those doctors that were on call to recover, which is very, very compared to of course, the burden of work that those doctors would face when
Hmm.
they're on call. Mind you, we have one of the problems we're also having is because we don't have equal distribution of these healthcare workers in Nigeria. That's another problem on its own. So you have them saturated mainly in the tertiary hospitals and all of that. Now, those cases, that come out, are not mainly in those tertiary places. They are coming out from the villages. If you're on call in a tertiary institution in Nigeria, you are on call for the whole state because in a state, you see basically one or two tertiary institutions, and you have one doctor in each of those institutions that is on call at a time. People that are sick, from everywhere in the villages and rural communities, they will all come to that tertiary institution to meet that one doctor. So if a
Yeah,
doctor is on
probably
call,
probably because the primary healthcare system is broken. That doesn't work,
it's
isn't
not
it?
working. Yeah, it's
Yeah.
not working. There's no, someone qualified enough to take care of those kind of cases there. And they would all, you know, swarm up in those tertiary institutions. So if a doctor is on call in a tertiary institution, he's managing basically the whole cases in that state that will be sick that day. So you can imagine the burden. And after being on 24 hours, he's still expected to continue working the next day till the closing hours of that day before he goes home. And then he still comes back, the next day morning again. Just because he's not on call on the third day does not mean that he's going to rest because he's still working. And that's just, the added stress that continues. There is no time for recovery.
But the doctor is human, and if they have to work such long hours, that means that they're prone, and if their immune
Definitely,
system drop and they get an infection or they get ill, then that's one doctor less, and that doctor also now becomes a patient.
definitely,
Is it that the management of this, you call them institutions, I will call them hospitals, so that people will clearly understand what it is that we're talking about? Is it that the management of these hospitals are not aware that this are a strong possibility, or is it a case of it just doesn't happen?
Well, everybody is aware of this. As I said, it's not a hidden fact that everyone is stressed. But of course, we always hide behind the fact that we don't have enough resources. Of course, the management would want, the hospital to continue working no matter what. And that no matter what is, of course, the thing that is crumbling the whole system, whether we like it or not. But of course, a management will just want the hospital to run no matter what, whether we have one doctor or not. And we have a saying in the medical field, unfortunately, that even if you fall down today and die, someone will take your place and continue the work.
Well,
It's sad that
that's for every profession, and I absolutely agree with it that you shouldn't go overboard and try to, kill yourself or unalive yourself. I don't know if the algorithms are going to fight me on this for using such words online.
yeah,
I don't know if
I've lost you
the
then.
algorithms are going to fight me on this, but that's the reality. If you drop dead, that's it. Somebody else is going to take your place. But in Nigeria, is somebody else truly going to take your place when you already have a shortage?
Almost immediately, Habib.
But you only have
Brother,
55,000
mind you, that's
doctors.
another stressed individual.
Yeah, but you don't have enough doctors. So where are they
Yeah,
going to get the doctors from?
it's almost, you know, funny how it happens that they always use to the left, of the human resource that is available to work no matter what. It's just too funny, and it's so sad, to be
But I've
honest.
also heard doctors complain about something similar in the UK as well, the NHS doctors, where a lot of them have been leaving. So some are going to Australia, some going to Canada, and some finding their way to the US as well, with very similar complaints. So would it seem more like a universal issue than just like a Nigerian issue, for instance, or a developing country issue?
Yeah, it all depends on what exactly we're talking about, Habib. If we're talking about health workforce shortage, every nation in the world has that problem when it comes to health workforce shortage. I will give you an example. The World Health Organization in African region, it did this very good research or documentation of the health workforce in 10 years. They call it a 10-year health workforce from 2010 to 2023 for African region. And even the best countries, the countries that are doing, well in terms of health workforce, like South Africa, like Ghana, they also have just 87 healthcare providers. That is including doctors, dentists, nurses, lab technicians, lab scientists, and all of that. 87 per 10,000 population, while countries with a low density like Nigeria have like 5 to 10,000 population. You understand the whole
Yeah,
health workforce. Um, this also cuts across other countries like the United Kingdom. If they have enough, will they be employing people from outside? They won't. So it's
yeah,
because they also don't have enough. With their growing population, people migrating and all of that. The NHS is overwhelmed as well with patients and all of that. They also don't have enough healthcare providers. Where the difference is what exactly these nations are doing that is different from probably what we are doing. That they tend to gain healthcare workers and we tend to lose those healthcare workers. You understand what I'm saying?
yeah. But like I said, like I mentioned earlier on, so there have been reports. I can't highlight any particular one in this instance of the NHS losing personnel. A lot of them,
Yeah,
right?
yeah,
And for some of them, they've also spoken about this really long hours that they have to work.
yeah,
So
yeah.
even though, you had mentioned earlier on that, you have the 40 working hours and all that, and all of that, there are still doctors who feel that those hours that they work are longer than the 40 hours. Quite a few of them have left. Some have even laid claim to be underpaid as well. Some of the stuff that we are hearing out of the developing countries, even though I don't like using
Yeah,
those
yeah.
terms, as in like, what exactly is a developing country? What exactly is a developed?
Developed
Depend,
country.
yeah. I think it could be quite derogatory using that term a lot of times.
Just lines and the map.
Yeah, you understand what I'm saying? So we've seen, some of them complain about stuff like that as well. So when we talk about what those countries are doing, that the African countries are not doing, I think a lot of it will be much more of a systemic issue than actually just it being a case of you have a shortage. Because if doctors are treated better, then you're probably going to have doctors who will stand by that oath and it will not be all of money, which seems to be what is at the forefront of the conversation when it comes to doctors leaving Nigeria. Most people think that doctors are leaving simply because there's more money abroad. But we've seen one or two doctors coming back to Nigeria to come and try to see what they can do to try to improve the system. So I've seen one doctor who started a health insurance, program, and he's doing very, very well. And there are about two other ones that I know of who have come to set up hospitals, maybe high-end hospitals for that matter, and they're thriving as well. So we are looking at a situation where you have some doctors seeing opportunities abroad, but you also have a few seeing the opportunities back here. So in terms of the difference, between what they are doing and what we are not doing, what exactly do you think that they are doing that we need to do as a country?
So it's good that you made that, that you cited that example with the fact that we still have some doctors in the diaspora who are coming back to Nigeria, and that just shows the fact that not all is not everyone that leaves because he left because of the money. Even if that was the reason, we still have people that still want to see our system, our healthcare system, our country, our people get the best out of healthcare as well. And so you will always find people that come back. And you also have people back home in Nigeria that are staying behind, regardless of whatever that is happening and all of that. And it is in the what those countries are doing, that we are not doing,
Yeah,
is providing a conducive environment to work in, regardless of what happens to, career progression. People will still be in the United Kingdom now and still see a better opportunity somewhere else and decide to leave.
yeah,
But the fact is that if it is about regulation, this is a country that have regulation on working hours, and you are at liberty to sign out of that. So
okay,
most hospitals here, some on your contract, they will tell you that, but they will tell you that they need you to work more. You sign out of that. Let me tell you one thing. When you work an extra hour and you're being paid for it, even if you're tired, you know that you're getting your remuneration for that.
yeah,
But when you work extra hours and you're not being paid for it, you're not even being paid, you're not being paid exactly what you're supposed to earn for the normal hours that you, and then you are also working extra hours and you're not being paid for it. That one is more stressful than this one. Of course, you might not be happy with the fact that you're being made to work extra hours and all of that. And then if you see a better place where they're strict with the working hours and all of that, and their pay is better, you would move. Even if you're in UK, Australia now is a better place. People move to Australia and all of that. But it still doesn't change the fact that we in Nigeria are not doing when it comes to the remuneration of doctors, of what they're supposed to earn. And also for those extra hours, they're not being paid for it. These calls that you take,
yeah,
you can see a doctor being on call I said a doctor can be on call every single day for 30 days in a month. You can imagine how many hours is that? That's almost 960 hours in a month. And a doctor probably is just paid for, I've forgotten the calculation, forgive me, but it's calculated per unit, of course. Probably just being paid for almost half of it, you know, in his own salary as the compensation for that extra hours that is the call hours. And the rest of it is just moved away. And that is every month, just goes like that. So of course the doctor will be tired of working in this system that doesn't appreciate them or incentivize whatever it is they're doing and all of that. And that is what those countries are doing differently that we are not doing. So in terms of monetary, you know, funding or trainings and all of that, there is no doctor that will tell you that he is in the UK and he's not been trained, or he doesn't, get trained every month. Um uh, you know, every 2 months and all of that. And those are the things, that make the difference. We have doctors in Nigeria. Some are just, um, just working, and there is no adequate training. If you don't decide to do maybe residency training and all of that, you
Mhm.
can just remain stagnant as a medical officer without, proper training and all of that. And you just remain there. So you yourself, you're just working for the system, but the system doesn't benefit you in any way. And those are the problems, Habib. I must mention that, of course, the recent development, the president has agreed to the policy which the honorable minister has,
The Nigerian
mentioned
president.
about, yes,
Okay.
the health workforce migration strategy that is, and that is one, a one of good thing that came out of all this, trying to mitigate the effect of the health workforce migration, trying to see that we do something about it so that at least we we tell our healthcare providers that, look, we know things are tough, but we're trying to do something, that assures us that, and you yourself, that we're going to give you the best in terms of working condition, incentives, and all of that, or, working hours and all of that.
What exactly
If
is it?
if
What
Abib,
exactly is it that? Yeah, what exactly is it that they're trying to do? Let me
if
ask
it
you
is
that first.
implemented.
Yeah, I mean, I was going to get to that because we have a lot of brilliant ideas, that are on paper. They call them policies, but a policy has to be a working document. In a lot of cases, they are not working documents. They are just stuff written on paper. Somebody signs up on it and then they just dump it somewhere. Now, you also now have some people who would actually push that paper to become a working document. But implementation, the capacity for the implementation now becomes another issue entirely. But let's first start. What exactly is it that the president has agreed to, in conjunction with the Minister for Health?
So basically, I think, so the thing is, according to that World Health Organization, 10 years of, the health workforce, the picture of the health workforce in Africa, you've got only 1 in 3 countries in Africa that, you know, um, that have documents like that or policies like that to guard around the health workforce, or, to curb the surge in the health workforce migration and all of that. So it's a good thing that we've had that also. The Minister of Health and all other, doctors and everybody came together to see that we need to provide, we need to do a little bit of research and create a document like that to see how we can, curb the surge in all of this migration of our own
Yeah.
medical professionals to the outside. And they presented it to the president, and he agreed to it, of course, in line with his renewed hope and all of that thing, political thing about, transforming the healthcare system in Nigeria as well. So the document basically looked at how they can incentivize healthcare providers,
Mhm.
look at the well-being of healthcare providers, train those healthcare providers, and retain them. Those four, I think, I've gone through the document and I've just decided to sum them up as these four. Incentivize and look at the well-being of those doctors, and then train those doctors and also retain them. These four major, ways, they think that they're hoping that with these four major ways, they can stop, the migration, all these, Jabba syndrome and all of, all of these things that makes doctors to, or healthcare providers to move out.
So they are not stretching the incentives to training more doctors.
So basically, the document, about the incentives, it was talking about the fact that this unequal distribution of healthcare providers, as I've said, you would have more healthcare providers maybe in Lagos. depending on also the population of Lagos compared to Abuja, and also in a state, in the local government areas, you have more healthcare providers in the state capital than any other local government area and all of that. So what they're trying to do is, and we have primary health care, we have thousands of primary health care cut across, which is a very good thing. To access universal health coverage, where everyone can access health care at an affordable rate, wherever and whenever, you need a strong primary health care, where you have just outside your home, you can just go out and access health care like that. But in those primary health care centers, we don't have these professional, healthcare providers there. Mainly, you would have community health extension workers and some volunteers and all
What
of that.
what what are
So what they're
community health
trying,
extension work?
so they are just health technicians. They call them health technicians who have gone through the School of Health Technology and all of that, and maybe 6 months to 1 year of training on just some basic, you know, healthcare, first aid, and all of that, and
Okay, okay.
maybe some disease of public health concern and all of that, and basically just put in the, primary health cases. They are part of the primary healthcare, but a primary healthcare is supposed to have a medical, they call it the CMO, the chief medical officer first, and then you will have a nurse, chief nursing officer, or the nurse that is responsible for that primary healthcare. And you also have another health, someone that is enriched with the health knowledge and all of that. After that, before you could have community health extension workers and then the volunteers. That is how a primary healthcare system should be. But then you will find that only community health extension workers are there to the volunteers. And unfortunately, in Nigeria, where people don't really have that knowledge of how these things are, a community
Yeah.
health extension worker could boast as a doctor, and there's no regulation. It all comes down to the regulation as well. So a community health extension worker boasts as a doctor, and everybody in the village calls him doctor, and he does whatever he wants. He performs surgeries, he does
So
give medication.
a community health, what you
Extension worker.
extension worker, basically, yeah. I mean, they're sounding more like first responders to me.
Yeah, yeah. So mainly they're just people that, of course, in a village or in a rural area, if you're doing maybe vaccinations and all of
Hmm.
that, all of those things that requires technical assistance, they will do it because it doesn't really need much of a, you know. So they take that stress off the healthcare, the what do you call them? The experienced healthcare providers fast. But the vice versa now turns out to be the case because you now find them in the forefront of doing all the
Yeah, because I'm wondering how a first responder would, suppose as a doctor, what level of damage could be done, especially when it is a case of they just don't have the experience or the knowledge to be able to deal with some complex cases that are initially brought to them because
yeah,
they're closest to the community. So I
yeah.
don't think that takes, the burden, I don't think that reduces the burden on the main hospitals.
It doesn't have
I
it.
think
It
I
doesn't
think
at
it's
all
gonna add
because
more.
it
I think it's
ends
gonna
up
add more. I think it's
it
gonna add
adds
more.
it adds more because you now run away from problems of working in a primary healthcare center, but the same problem meets you in the tertiary hospital because
Yeah, that's
a
what they
chief
need.
community health extension worker decides to do whatever he wants. And whenever he cannot do it again, he
I,
bundles the patients up and sends to the tertiary.
I mean, it's amazing because when you look at Lagos, for instance, Lagos is the most populous state in Nigeria. Even though Lagos, you really can't even call Lagos a state anymore. Nobody understands what to call it except it's a megapolis of sorts. You have only 11,000 doctors, according to the records. In Abuja, the FCT, you have just about 6,000. So I can't imagine how few, the number of doctors are in states like Jigawa, Ebonyi, and Niger, for instance, or Gombe. So you really do have a major issue there if you have to
Yeah.
use community health
Yeah.
extension workers, to fill in the gap and that kind of stuff. Definitely the doctors are going to be really stretched out. Definitely they're going to be
Yeah.
working really long hours simply because
Yeah.
in some cases you're just about to go off call or your shift, and then a case is brought in that has become so much complex simply because you had somebody who was unqualified attend to that person in the initial. That's definitely
Exactly.
going to be an extra layer of stress on the healthcare system. For someone like you who has experienced working in the healthcare system in Nigeria and also working in the healthcare system in the UK, I would have said abroad, but I'll be more specific in the UK. Do you think that there's any type of specialized knowledge in terms of administration that yourself and some of your peers would be bringing back to Nigeria to try to restructure the way the healthcare system is managed in Nigeria?
Yeah. And I must say that, we're fortunate enough to have, you know, people who have had a taste of what it is outside of Nigeria, heading, two of the most important, organizations regarding, the welfare, the whole thing about doctors and healthcare providers in Nigeria. One, the minister, the honorable minister, the health and welfare, and also Dr. Fatima Kari, which is the new registrar for the Medical and Dental Council of
Okay.
Nigeria. It's you could see that what they're doing now, whether it's yielding any positive thing or not, is one thing that has not been done before. Whether it's going to yield anything positive or not, we still await it, but they're trying their best to see that they bring like this policy, for instance, and Dr. Fatima Kari of the MDC and also trying, her possible best to see to this working hours of a thing, becoming, something of the past as well and all of that. So of course, those are the kind of, experience that you get from practicing outside of Nigeria that when you come back home, you would want to see, you know, those changes put into effect.
Yeah.
And of course, for me, you could see that honestly, I want the best for Nigeria. There's nothing that excites me more than seeing our own healthcare system, becoming this robust healthcare system that it could. I mean, we have all that it takes to become the best healthcare system in Africa and compete with other healthcare systems in the world. We have doctors everywhere you go, and you would in every institution, and I lie you or kid you not, in every institution or health institution or hospital outside of Nigeria, wherever you go, whether in Saudi Arabia, Germany, United Kingdom or United States of America, if you if you're looking for, you know, professional mind in one department or another, you would definitely find a Nigerian. So medical tourism, for instance, people leave the country to go out to seek healthcare in other
Yeah.
countries, but they end up meeting Nigerians there. So how is it that we're losing all these bright minds, that we could keep in our own place and reverse the tourism back to Nigeria when we will have all those bright minds in Nigeria, and then people would definitely come to see them. All their patients will come to see them from outside, and then we're losing them to the outside
Oh,
world.
yeah.
So that's why I strongly believe that we can make the healthcare system better if we have the people with the right intention.
But you two, you are jackpot.
I have left.
You two, you are jackpot.
But I have left, but I am still right.
So yeah, you are correct. I mean, I have one hero, his name is Dr. Lutoye, I'm sure you've heard of it, who
Yeah.
performed this really rare surgery on an unborn child. Very successful surgery. And the first time I heard about it, I said, is that really possible? So I decided to go and read up a little bit on him, and all, and I just realized that we do have some of the best doctors in the world. The infrastructure is just not there. Our doctors leave, we go to other countries, and wherever they are, they excel. Just, the same as other professions as well. But people keep on running from Nigeria, I myself inclusive, although for my reasons were not initially economic. But
That Habib, did you jump up or not?
that's what I'm saying. I left also, although, I didn't japa because it wasn't initially an economic issue. It was more of a family
Yeah,
issue.
yeah.
And I couldn't handle it after 5 years. I had to keep coming back, and all that. So I spent a lot of time in Nigeria trying to do something or the other, trying to see whatever little it is that I can contribute or give back in terms of, professionally and, otherwise. And I know that there are thousands of people who are doing the same. As a matter of fact, for most Nigerians, when they travel abroad, the first place that they usually go on holiday when they get the opportunity is back home to Nigeria. You know, for whatever reason, some people say it's just, they're just going to go and show up. They want to show that they've arrived. They want to whatever with the little pounds or dollars that they've acquired, that kind of stuff. But whatever the reason might be, they're bringing something back into the economy.
Yeah.
So you always have a reason for doing something. So part of that reason is positive at the end of the day. You will always have the naysayers who will always come at you and say, blah, 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 kind of thing. So to encourage Nigerian doctors to come back, invest in Nigeria could be a bit of a challenge. I'm very aware. Why? Because of regulatory issues. A lot of the times you see civil servants, actually putting cogs in the wheel in terms of you being able to set up, go through the Nigerian Medical Council, go through the Ministry of Health, get all your certifications, blah, 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 blah. But then you also don't have the issue of capacity as well. So several years ago, I heard for the first time, the term auxiliary nurse. And I was very confused. I didn't understand what that meant. What is that auxiliary nurse? And today now, several years later, we're hearing community health extension workers. I've never heard that. I know that there are a lot of rural areas that are suffering because they don't have primary health care centers. For some that do, they don't have any personnel. For some, they have the personnel, even though they're not doctors. So
Yeah.
let's say they are the community health extension worker.
Yeah.
90% of the time, they don't even have electricity. So how do they even manage, the people that come in and out of those primary healthcare centers that actually need help? So it can be pretty challenging, but I know that it is possible and it can be done if a lot of doctors do collaborate and they try working towards doing something back in Nigeria or even in Africa. So for someone like yourself, what I would say is this: for Nigerian doctors to be doing so well abroad, that means that they do have the capacity to come back and change the system. Your camera is off. Hello? Are you there?
I can hear you, Habib. Is it up?
Yeah, your camera went off. So you can't see your face anymore.
Do I do now? Let me see. Is it back?
Yes, it's back now. It's back now. So you're an advocate for, the welfare of Nigerian doctors in Nigeria, and now you live abroad. Do you advocate for Nigerian doctors abroad as well? And I have to ask you that.
So in very honest, answer, of course, yes, I would say yes. I advocate for Nigerian doctors everywhere. But of course, it is mainly for those of us that are left back home in Nigeria and facing all of these challenges. The ones that have left are finding it a bit better wherever they are and whatever circumstances they find themselves. They're finding it a bit better than those of us that are left back home. And that is why I would say yes, I advocate for every one of us, but I'm advocating more for those of us that are left in Nigeria
Okay.
because
I saw
yeah,
a post of yours on LinkedIn where you were talking about a doctor that died due to stress. What actually
yeah.
happened there?
So we've had several deaths of medical doctors in Nigeria that are somewhat stress related, but of course, some are directly, the story are, directly related to, the stress where a doctor was on call and he collapsed and then, or maybe after being on call for like 72 hours, he went back home and then collapsed and then died. But this recent one that I posted on LinkedIn was a case of a doctor in Kenya, which is just to show the African thing. The system is all like that.
Was
Even
it
though Kenya
was it a
has a
Nigerian doctor?
no, he's a Kenyan doctor,
Okay, Kenyan doctor. Okay.
Dr. Desri. Yeah, that one committed suicide, but she left a note and she clearly stated that it was after a 36 hours call straight. She was on call 36 hours. So when she came back home, she left a note that she was depressed, she's tired, stressed, and all of that, and she just can't take it anymore. And she took her life. But even though he's a doctor that is far away from us, it doesn't. It still, narrates what happened to all the doctors back home in Nigeria as well. We are having deaths of young doctors, and we don't ask why. But if we should ask why and probe into why these deaths are common these days, we could see that it is definitely going to be a stress related deaths, a mental health issue and all of that. Because I tell you, Habib, since when I started this whole advocacy thing, I have had messages from a lot of doctors, a lot of doctors coming up and saying, I've been through this. I'm still going through this. This is my worst nightmare. It has affected me mentally and all of that. There's a study I conducted. And one of the questions that I asked was, if you could get, do you think your working condition affects the way you give your care to your patients? And the answer was almost 99%, yes, for for that question.
So in closing, Alamin, when you look at the treatment of doctors globally, because from what you're telling me, this seems to be more of a global issue.
Due to some technical issues, we couldn't finish our session with Alamin, but I'm sure you all get the general gist. So doctors do need doctors, and doctors all over the world actually need to be taken better care of. So we hope you all got the general gist, and we all hope that you'll be able to look into talking to your doctors and actually asking them, how are you at some point in time. You take care, and thank you all for taking out the time to join us again. Watch out for the next episode of the Habib Enyola podcast. Ciao.